On this video, I'm going to demonstrate the psoas technique. That actually involves two muscles that flex the hip. One being the psoas major that originates right here on the lumbar spine, and the other being the iliacus that originates right over here on the hip bone. Both of these two muscles cross over the viscera and into the lesser trochanter of the femur bone or the thigh bone. Now, if this muscle is tight, it can cause a couple of problems. Number one, what can happen is the femoral head, which is the thigh bone here, can pull into this socket here. And what can happen is you wind up with an adhesion, which basically means you're taking Elmer's glue and putting it in there, and you have a limited range of motion. Another thing that can happen is because if it's tight on this side, this muscle here called the quadratus lumborum can overstretch. And what you have then is an imbalance. Another thing that can happen is because of this imbalance, you can wind up with a tight piriformis right here that can compress against the sciatic nerve, and you wind up with sciatica, which is a pain that radiates all the way down the leg into the heel. So in order to test the range of motion, what we're going to do here is we look for range of motion. So the normal range of motion is between 35 and 45 degrees. If this is restricted, it means that it's not releasing. So if we have a limited range of motion, it's not going to be releasing. So here I have Tom on the table. And Tom, why don't you pick up your right and see how high you get. Okay, here we see, go ahead, set it down. Here we clearly see, and I'm going to get it, and we can clearly see we might have maybe about 5 to 20, maybe about 15 degrees range of motion. Now we're going to check the left. I'm going to pick that up. Go ahead, Tom, pick it up. That's more normal. That's better. So this indicates to me that on the right side what's happening is the psoas and the iliacus are tight. So what we're going to do now is we're going to flip them over and we're going to work the iliacus and psoas major. Thank you. Okay, in order to release the psoas, I'm going to put my hand right here where the muscle attaches, where it originates. I'm going to do a little bit of rocking motion here, which kinesthetically tells the muscle to relax. Tom, just going to relax. Just going to relax for me. Good. Just going to relax. Good. Good. Now I'm going to bend the knee. Just going to come over here just like that. Okay, Tom?
Yep.
Okay, good. I can feel it right there. Starting to release. Okay, now I'm going to get into the iliacus muscle right here. Oh, you got it? There we go, I got it. Deep breath. Try it again. Got to take a deep breath. That's good. Another big deep breath for me. Okay, I'm going to take the knee up like this. Just relax it. That's good. Now I'm going to pick it up. Don't let me, no, that's good. Let I said, that's perfect, just like that. Okay, good. Now let's flip you back over and we'll see what we get. Okay, now we're going to see how well that psoas is doing now. So go ahead, Tom, pick it up as high as you can. Very good. So here we see the psoas is now releasing, so we get a full range of motion. Okay, that's very good. Now, tight muscles create muscle asymmetry around a joint. What we found out is that weak muscles permit this asymmetry. So usually what happens is because the psoas is tight, a lot of times the glutes and the proximal hamstrings are weak. So Tom, what I want to have you do is I want you to pick this knee up as high as you can. Straight, that's it. Set it down. The straight knee, go ahead and pick it up. Is that high as you can get it?
Yep.
You can set it down. I'll pick it up one more time. Okay, set it down. On Tom, the psoas was tight, and it was restricting his range of motion and extension. However, the opposing muscle is there for weak. What we need to do is not only stretch the tight muscle, but we want to strengthen the opposing muscle. So Tom's going to use this active isolated stretching and strengthening here. So go ahead, Tom, pick your knee up, and you're going to stretch at the end. Good. One more time, inhale, exhale, bring it up, and like that. One more time, go it up, bring it up, and I'm going to come up there and just give a assist at the end. Okay, so now Tom is going to stretch the psoas, iliopsoas. So Tom's just going to come forward like that, good, and then up. Keep your lumbar lordosis back a little bit more like that, Tom.
Oh, yeah.
Good, just like that. Inhale and exhale, just like that. And that's what we do here at Doylestown Activated Isolated Stretching. We look for limited range of motion, we put it back into a normal range of motion, and we create balance and symmetry within the joint and the muscles. Thank you very much.